for a chat now with Melanie Wicklen, who is Chief Exec of Age UK Cambridgeshire and Peterborough. Melanie, good to talk to you. Good morning.
Good morning.
And as Caroline, listener, made the point, it's not just the elderly who will be affected by this plan, but a large proportion of this plan does relate to us all getting older and living longer. Are you welcoming this announcement today, whatever it is?
Yes, we certainly are welcoming the announcement. Our national partner, Age UK, have been campaigning for this for quite some time because of the current state of the care system, which is being scrutinised at the moment quite rightly because we've had such terrible times throughout COVID, but actually this isn't an issue that's just been caused by the COVID pandemic. It's a problem that's been there for many, many years. With declining access to social care, the whole confusion around health and social care, and we just want this to be something that is far more joined up from a health and social care perspective.
Well, what is the state of the system in Cambridgeshire and Peterborough then, as it stands, Melanie, from your experience?
From our experience, I mean, it's pretty much the same across the country, where you are seeing quite a lot of underfunding across the local authority social care system. I think since 2010 we've had nothing but cuts each year, which doesn't help when you've got an ageing population. You do see some signs of postcode lottery where there will be better care in certain local authority areas, but that doesn't detract from the fact that there have been the cuts every year since 2010. And we also see that there are so many older people aged 65 plus who don't actually receive the care and support that they need. And that puts a lot of pressure on the unpaid carers that we have in our county, people who sometimes don't even realise that or consider themselves to be carers because they are family members. And it's people like that that actually need a lot more support from the system.
What do you want to hear from the Prime Minister today? Ideally, what would be the best result from your organisation's perspective, representing all of these people who, looking after loved ones in older age who they love dearly, or people who are accessing the system? What do you best want to hear?
We want to see fairness across the system. So we want to see a social care system that is very much like our NHS healthcare system. It's accessible to all when the need is there. Not only does that bring the fairness, it also stops the confusion of which system is providing the support that we may all need in time. We want care in the communities, whether that's in homes or provided, residential or nursing homes, or in the homes of people in need of social care, to be recognised as a really good, well-paid role that is recognised and well trained, so that at the moment, unfortunately, care is well known for being a role that is perhaps undervalued, and also a great turnover of staff. And we want that to be seen as a profession moving forward, so that it attracts more people, and the quality of care will be there, and it's available for everybody who requires it.
Do you think, despite however hard they are trying, the people working in care homes, working in the care systems to provide this, provide this care, to provide this love, however hard they try, in the current climate, in this crisis, we're not treating our mums, our dads, our grandparents, our partners, we're not treating them as well as they deserve?
I would agree with that. There's such a strain on every part of the system at the moment that it's not possible to provide that. And I think the decisions made in Parliament today, or announced in Parliament today, will be the way to tackle that. And it is going to cost, and the money needs investing to make this a much better opportunity for the future of our health and social care system. Both need sorting.
And how often do you hear from people like the emailer we heard from 10 minutes ago who say, we've spent an entire lifetime being thrifty, putting money aside, being really careful, and now all of that money is gone, and that is not fair. Is that a common thing that you hear?
Extremely common. We hear it all the time. And the other difficulty with that is not only the amount of money that is being spent, people very often do not know where to turn. They do not know what level of care they actually require because they are self-funders. And many people don't realise that they can still go to their local authority, even if they have the funds, to access that support, to ensure that they access the right level of care. So many times we've heard of people who perhaps enter residential care at a stage too early. They perhaps don't want to go, but they feel that's their only option, or they're perhaps buying too much private social care within their home. And really, they need to be able to access that support to determine what their needs really are now, and they can change in the future and grow, rather than paying everything out at the moment. And this is why we need that equality across the system, so that everybody has access to the same level and quality of support.
Yeah, and you're there to help them with such conversations, with such questions at Age UK, Melanie?
Absolutely. We'd really like to promote the fact that, please do come to us, because we can have those conversations with you to allow you to understand the options that are available to you. And I think it's really important to have those conversations before making such decisions, because they're huge decisions, life-changing decisions.
Melanie Wicklen, good to talk to you. As always, thank you. Chief Executive of Age UK Cambridgeshire and Peterborough. Still